NSAIDs relieve pain, fever, and inflammation, but carry meaningful risks, especially for people with stomach, kidney, or heart disease, older adults, and those who are pregnant. They're most they're most appropriate for short-term symptom focused use at recommended doses, and long-term use should always be guided by a clinician. Common OTC options include aspirin, ibuprofen, Advil, Motrin, and naproxen. NSAIDs work by blocking COX-1 and 2 in enzymes, which reduces the body's production of prostaglandins. Chemical messengers that trigger inflammation, pain, sensitivity, and fever. This mechanism explains both their benefits and their risks. Prostaglandins also help protect the stomach lining, regulate kidney blood flow, and support platelet function. They come in multiple formations: oral tablets and capsules, chewables, liquids for children, topical gels and creams for joint pain, and prescription only injections or high dose tablets used in acute medication or medical settings. Common NSAIDs examples: over-the-counter aspirin, ibuprofen 200 to 400 milligram, naproxen 220 to 440. These are widely used for headaches, muscular, menstrual cramps, muscle aches, and minor injuries. Prescription stronger celebroxin, a COX-2 selective NSAID that may be gentler on the stomach. Diclofenac, oral and topical. Endomedicine, often for gouts, flares, and keto Larac, potent short-term only due to high GI kidney risks. How to use safely. Practical guidance. Short-term OTCs limits no more than 3 days for fever, or 10 days for pain unless clinician advises otherwise. Persistent symptoms may signal underlying condition that needs evaluation. Topical dosing examples: ibuprofen, start with 400 milligram, then 200 every 4 hours as needed, not exceeded. Do not exceed 1200 milligrams a day. OTC, over the counter. Okay, naproxen, guys, is 220 milligram every 8 to 12 hours. Do not exceed 660 milligrams a day. OTC, take with food or milk to reduce stomach irritation. Avoid combining multiple NSAIDs at once, e.g. ibuprofen plus naproxen, which increases risk without improving pain control. Key risks and who should avoid NSAIDs: gastrointestinal ulcers, bleeding, and perforation can occur even without warning symptoms. Risk: increases with age, alcohol use, steroids, anticoagulants, and higher doses. Cardiovascular: most NSAIDs, except low-dose aspirin, can raise the risk of heart attack and stroke, particularly with long-term use in people with existing cardiovascular disease, kidney and fluid retention. NSAIDs can reduce kidney blood flow, leading to acute kidney injury, sodium retention, and swelling. People with chronic kidney disease, heart failure, or uncontrolled hypertension should use extreme caution. Pregnancy: NSAIDs are generally avoided in the third trimester due to risk of fetal kidney problems and premature closure of the ducts arterioles. Children and teens with uh, viral illness avoid aspirin because of Rye syndrome, a rare but life-threatening condition. Important drug interactions. NSAIDs can interact with anticoagulants and antiplatelets, such as warfarin, clopidogrel, increase bleeding risk. SSRIs, SNRIs, higher GI bleeding risk. Uh, Lithium, methotrexate, increased drug levels and toxicity. Diuretics, ACE inhibitors, ARBs, reduced kidney function and altered blood pressure control. Always check with a pharmacist or prescriber if you take chronic medications. When to call a clinician or seek emergency care. Seek immediate help if for black tarry stools, vomiting that looks like coffee grounds, severe abdominal pain, chest pain, sudden shortness of breath, weakness on the side, vision changes, irritability, inability to urinate, jaundice, or severe rash. All potential signs of serious NSAID complication. Alternative and practical tips. Acetaminophen, Tylenol is often safer for people with GI or cardiovascular risk, though it does not treat inflammation. Topical NSAIDs like diclofenac gel can offer joint relief. Joint pain relief with lower systematic exposure. For chronic pain, consider physical therapy, heat, ice, exercise, weight management, and mild mind and body approaches alongside the lowest effective dose medication strategy. Resources. This came from Cleveland Clinic, guys. Okay, so that is A for you. I'm gonna go take a little break, and I'll be back to do B for you in a few minutes. For now, Gator Wellness. Take care, folks.